So what's ICSI? ICSI is a procedure by which we use one sperm to inject into an egg, and that's a method of fertilization. There are two different methods of fertilization you would have heard about. It's a standard IVF procedure and ICSI. ICSI, on the other hand, is a procedure where a highly skilled embryologist will handpick a sperm and put it into the egg. It is assisted by a powerful microscope and a couple of micro manipulators or instruments that are microscopic, which helps the embryologist to pick a sperm that is found to be very viable and probably one of the best in the sample of sperm given by the male participant in the process. This sperm is then injected with the help of a micropipette into the egg directly, and we check for fertilization about 18 to 20 hours after the process. It's indicated especially when you've got problems with the sperm. It may be in the form of very low sperm volume, low sperm count, or sperm that's not very motile or has abnormality in its shape that requires a little bit of further assistance for fertilization. There are times when patients have had no obvious reason and no problems with the sperm. However, they've had an IVF cycle, a standard procedure was performed, and there was a failure of fertilization. In those circumstances, we would again advise that they undergo ICSI. There are some patients who have had egg freezing, and after the eggs are thawed from a freezing procedure, they often lose their capacity to have a standard sperm enter into it and cause a normal fertilization process, because their outer covering or the wall of the egg is quite rigid, and therefore we would use ICSI as the mechanism of fertilization. So when in doubt and you're not sure that ICSI is the procedure for you, it's best to come and talk to your fertility specialist to discuss what ICSI is and whether it is indicated and will be a better procedure for you.